attendees are in listen-only mode.
It is my pleasure to welcome everyone today to this webinar on mycotoxin testing and survey results hosted by BIOMIN and Romer Labs. My name is Hines, and I'm the editor of Science and Solutions. Joining me here in the studio are Simone Schaumberger, product manager at BIOMIN, and Philipp Gruber, product manager at Romer Labs. Welcome to you both.
Hi. Nice to be here.
Now, when we get started, I'd just like to point out that both companies who are part of EBA Group approach the topic of mycotoxins from somewhat different angles. BIOMIN offers cutting-edge mycotoxin deactivating feed additives. Romer Labs specializes in innovative diagnostic testing for mycotoxins and other analytes. I'd like to remind all of you listening from your computers that this is an interactive live webinar. When you open the toolbar on the right-hand side of your screen, you'll find a chat function for issues relating to any audio, visual, or other technical problems that pertain to the webinar platform itself. There is, in addition, a questions function. And the questions function can be used at any time throughout the session to enter questions for our two speakers. And it can also be used later for the open Q&A later on. In addition, you, the audience, can vote at several times throughout today's session. When I announce a poll question, you'll have the opportunity to provide your input in real time. I will then announce the aggregate results of those polls. So let's start with our first poll question. Poll question 1. Have you encountered a problem with mycotoxins in the past 12 months? Now is your opportunity to go ahead and select yes, no, or maybe. And those results are coming in real time. We have over half of you who have already been able to submit your feedback. We're going to keep the voting open for just a few moments more. And we see that yes is already starting to win. Voting is still open, so you still have an opportunity to choose yes, no, or maybe. And now we will close the voting. Thank you for providing your input. Okay, my final count, the majority of you have been able to vote in the first poll question, and 59% indicate that yes, mycotoxins have been a problem over the past year. 24% have indicated no, and 17% of you indicated maybe. So signaling there's maybe some uncertainty. Now, Simone, can you remind us about the relevance of mycotoxins?
So again, Ryan, thank you for a kind introduction. Basically, it's a clear fact that mycotoxins cost the livestock industry billions of dollars. And here we see again that we had a lot of people experience these problems. And this problem mainly is because, on the one hand, the commodity is experiencing a decrease in quality when contaminated, and therefore they have maybe to be thrown away, or you need other commodities to buy. And on the other hand, we have the negative effect on the productivity of the animals, which is decreasing in the presence of the secondary metabolites of fungi.
Right. Thank you for that background. Now, based on the results of the first poll question, it would certainly seem that mycotoxins are a significant issue for the industry. Now, the 2015 BIOMIN mycotoxin survey, which covers more than 8,000 samples of finished feed and single raw commodities from 75 different countries, probably gives us some indication of the concern regarding mycotoxins as well. What do the latest results show?
Yeah, the latest results definitely show that there is that we are dealing with the problem of mycotoxins, and we know, as Ryan mentioned, we have sampled over 8,000 samples with over 31,000 single analyses of the different mycotoxins. Um, um, um. So the figures which are now displayed on your screen represent the worldwide mycotoxin distribution in 2015, including the risk threshold levels represented by the dots. The bars show the percentage of samples contaminated with the different mycotoxins. For instance, we have 73% of deoxynivalenol contamination on a worldwide base, represented by the gray bar. And in nearly 60% of all samples, fumonisins and seralenone were detected, as shown by the orange and the red bars. Additionally, as mentioned, the dots display the occurrence of mycotoxin above the risk threshold level, which are based on the most sensitive species. So if we again take Dawn as an example, we see that 77% of the positives tested contain this mycotoxin, which pose a risk to piglets and sows, which are the most sensitive species in this regard. In the table below the graph, you see the average concentration of each mycotoxin and the highest single occurring concentrations. In general, we can observe once again that deoxynivalenol and fumonisin pose the highest health risk to animals. But now have a closer look to selected commodities. In grains such as wheat and barley, we observe high levels of deoxynivalenol and contamination, which is followed by seralenone and fumonisins. When we have a closer look to maize and maize products, we see that there is a high percentage of maize containing deoxynivalenol, fumonisin, and seralenone, as well as AFLA above the risk threshold levels. This is again reflected in maize silage, which you can here see on the right side of the slide. Also, protein sources are a great component of concern. And here we can see that the diet, such as DDGS, displayed on the left side, can be a high source for mycotoxins due to a concentrating effect of these substances in such a byproduct. So, what does this in general mean for finished feed? On the left side, we see the worldwide results for finished feed. But I want to give you a practical example using a typical Central European broiler feed composition. When we take, for example, the average contamination levels of the worldwide results, and if we even only use 60% of the high-risk maize and 30% of soy used for the feed, the total load of seralenone and deoxynivalenol still exceed the risk threshold levels that we see that could cause various symptoms in broilers, such as reduced performance and an increased susceptibility to different diseases.
Now, that's an interesting example. What does this mean for livestock producers and other species of livestock in various regions across the world?
Yeah, that's very interesting. Let's go on. So, with these figures, I want to give you an overview of the percentage of samples above risk threshold levels in Europe and Africa, represented by the different bars. The animals displayed should show the most sensitive species for those results over the risk threshold. The maps displayed should show the origin of the samples. In Europe, which is displayed on the upper case of the slide, you see a higher number of samples have been analyzed for various mycotoxins compared to all other regions. In general, we observe deoxynivalenol poses the highest risk to livestock, showed by the gray bars in Europe and in Africa. This is the reflection as well what we observed with the previous slides on commodities on a worldwide basis. In Asia, over half of all samples contain deoxynivalenol at levels that pose a health risk to livestock. More than 1/3 of those samples are contaminated with seralenone at concentrations over 50 ppb. Asia faces, in general, the highest threat to aflatoxin-related risk to livestock. And so let's come to America. As in all regions, deoxynivalenol also poses the highest risk to livestock in North America, with more than half of all samples above the threshold level. In South America, compared to that, 25% of samples exceed the risk threshold for deoxynivalenol, and the main difference here is the high risk that is posed by fumonisin, with 43% of samples above 750 ppb.
So for everyone listening who would like to know more about the threat from mycotoxins, what resources are available?
So, if you would like to learn more about mycotoxins or inform yourself about your regions, we have developed a special app which includes the latest findings updated on a quarterly basis. This information includes specific information on mycotoxicosis per species and for sure on the region and the respective mycotoxins. Additionally, I again want to point out that the report on new detailed data of the complete mycotoxin survey 2015 will be released after this webinar.
All right, thank you for that, Simone. Now we're going to turn back to you, the audience, for our second poll question. And our poll question number 2 is, how do you test for mycotoxins? Option 1, on-site testing. 2, external analytical service. 3, we do not test for mycotoxins. Or 4, unsure. Please take a moment to choose the answer that best fits your current operation. We already have more than half of you having chosen your answer. Those results are coming in quite quickly. We'll leave the voting open for just another moment now. Okay, now we will close the voting. Thank you for participating in the second poll question. I will now announce the results. So for on-site testing, 25% of you indicated that that was method of mycotoxin detection. Full 53% chose an external analytical service. 14% said we do not test for mycotoxins, and 8 are not sure. So, Philipp, how do these results compare with your experience in the field?
Well, analytical service is available for many, many years now, and is again, like we saw previously today, very widely applied. I think customers still appreciate the reliability of reference methods. The other point would be the on-site methods, which had about 25%, I think. It's a good value, and I think this reflects also a trend we observe in the market for several years now, that more and more people are using on-site methods because they're becoming more and more convenient for them.
All right. So can you tell us more about the available methods and perhaps between the different options of on-site and external analytical service, how do you choose the right one?
Your first step would be to decide whether you want to send in your sample to an analytical service lab or whether you want to perform the testing by yourself on-site. To decide this, you would have to consider 3 things. The first thing would be the throughput of testing you have. If you have a high throughput, a lot of samples to test, it might be worth to set up an on-site testing. If you rather test occasionally, well, it might not be worth it to make the whole setup from on-site testing, and you would rather send in the samples to an analytical service lab. The second point would be the time to result you actually can accept. With on-site testing, you can get the fastest results possible with rapid methods. So you would have the results within 1 hour. You don't have this speed with sending the samples to an analytical service lab because you would have to wait, well, about 1 week from really sending the samples away until you receive the result. So if your decision making depends on it, you would rather go for rapid methods, on-site methods here. The third part is the quality of results you want to have. On-site methods are mostly screening methods. Rapid methods are mostly screening methods. So you have a result variability of about 20 to 30%. On the other hand, the analytical service gives you the opportunity to also get results from reference methods. And those, well, they're having a higher reproducibility.
So when it comes to on-site testing, is there just one approach, or are there several options available?
The most popular options, there are strip tests and ELISA tests. There are many more out there, but the most popular are those antibody-based methods. If you have to take this immediate decision, and if you have a small sample size, strip tests are designed for you. So imagine you have a truck waiting at your gate, and you have to decide whether to accept or reject the lot it's carrying. You will take the strip test, gives you results within 10 minutes, and that will help you with this decision of acceptance or rejection a lot. If you have to test for more than 6 samples at the same time, you would go for ELISA testing, because it's with more than 6 samples at a time, it's faster, it's also getting cheap, and you can test up to 44 samples, actually, if you use a multi-channel pipette at the same time.
All right, so that's certainly helpful. What about on the analytical service side? What can you tell us there?
It's not done with just sending the samples away to the lab. You still have to decide from which technology you want to get the results. So you also have the possibility to get the results from ELISA testing. It's actually the same tests that are also available on site, but here they are performed by a service lab staff. They're the cheapest. They're still screening methods. You have a less reproducible result, and you can only analyze for one target with one run. On the other hand, you have these reference methods, HPLC and LCM-SMS. You can, the big advantage is that you can analyze for multiple targets with one run. HPLC gives you the opportunity to combine toxins with one run. For example, you have to take this package of DON, FUM, and zearalenone simultaneously. If you go with LCM-SMS, you even have the possibility to analyze up to 18 different mycotoxins with one run. In the regarding price, or regarding accuracy first, HPLC and LCMS give really accurate results, really reproducible results. The LCM-SMS method is additionally accredited with Romer Labs. So you have more reliability through this accreditation. If it comes to price, well, ELISA is the cheapest, and then it goes up. HPLC is a bit more expensive, and the most expensive is LCM-SMS.
All right, so thank you for those weighing those options for us and giving us an overview on both the on-site side and the analytical service side. One of the questions that we received regards rapid tests. So the question from the audience member is, can I use rapid tests to check finish feed? What do you say?
Our recommendation is to monitor the input and the output of finished feed production. So we recommend to really screen your raw materials. You can nicely apply rapid tests here. And keep in mind that the costs increase when the contaminated product moves downstreams. So the best mycotoxin strategy is to get the contamination before it hits the mill. Well, if you then want to test for finished feed, for the output, it depends on the amount you have and on the variability that your feed composition has. If you have small quantities and your composition will change a lot, you would go for an analytical service. But if you have bigger quantities and your composition, your formulation isn't changing that much, you could go for a customized protocol and apply a rapid test, actually.
Okay, can you tell us a bit more about the protocol?
With rapid tests, the thing is that you would need to apply the correct protocol for the given agricultural commodity. This is because the nutritional composition of commodities is different. We have here two examples. One is corn, one is soybean. If you look at the nutritional composition and we look at carbohydrates, for example, we see that there's a lot of them in corn. Because these are average numbers, rough numbers, of about 70% with corn, with relatively low carbohydrate amount in soybean. If you look at protein contents, it's vice versa. It's the other way around. If you go then to fats, it's more or less the same. But still, the kinds of fats and the kinds of proteins and the kinds of carbohydrates are still different within these agricultural commodities. So what these components do with your test reaction, they interfere it. They interfere with your test reaction, and that's leading, or it's possible that leads to over or underestimation of your test results. It's also possible that your reaction is blocked at all. And the result of that, well, it's a possibility of getting false positives, false negatives, and we know that's a severe problem, and we don't want to have that. So the strategy against is that you compensate this influence with specific protocols that are available for your agricultural raw commodities. So you would have a protocol for corn, and it's possible to have another protocol for soybean. The difference could be that you would have an overestimation of your results with soybean, and the protocol applies another dilution factor. If we come to feed testing now, the tricky part is that the feed composition from the raw commodities vary with markets, with season, with origin, and therefore we have a huge variability in the composition of the feed. So it's impossible to really get one feed protocol for all types of feeds. So you would need to have a lot of feed protocols for a lot of types of feed, meaning that you would need a customized protocol for your feed formulation.
Okay, so in general, how reliable are these different methods of mycotoxin testing and the results?
I want to share this slide with you when answering this question. And the interesting part is that if you look at the total error from the whole mycotoxin analysis, from the part where you take the sample until the part where you really conduct the analysis and get the result. What is interesting is that the analytical error, really from the measurement, we're talking about rapid tests, reference tests, these would be the tests, these would be the things that contribute to the analytical error, is relatively small in comparison to the sampling error. And you have to do the sampling error for all methods. So we have to be careful with sampling. There's estimations, a lot of numbers around. One is that 76% of the total uncertainty comes from sampling. So why is that? First of all, there's the thing called PPB problem. We are measuring mycotoxin in a very, very low concentration, and also the regulations are at very, very low concentrations. They are at ppb at parts per billion. To get a better imagination of it, it's comparable with 1 second in 32 years. So it's a very, very low amount. It's hard to find it. Second thing is the uneven distribution of mycotoxins in a lot. And this is because it's possible that only 1 year in an entire field is contaminated, and subsequently you would find only hotspots in an entire lot of, well, okay or not contaminated grains. To demonstrate it, we have one table here from the mycotoxin survey, And what we see here are 6 corn cobs from the same field, picked from the same field, just 5 meters apart. And well, it's astonishing that your contamination levels of various mycotoxins vary a lot.
All right, so it looks like there are a few obstacles to getting to the right results when it comes to sampling. Do you have any guidelines or tips that we could use to overcome or mitigate the sampling error?
We can share some tips here. Only tips, rules of thumb. The EU recommends there is one EU recommendation, and it says that up to 50 tons of cereal lots take 10 to 100 incremental samples of each 100 gram. If you take the rules of thumb, you can say that if you increase the sampling number, if you increase the sampling size, and if you also imply a finer grind, you can reduce the sampling error. What we offer is a sampling guide, sampling quick guide, offered by Romer Labs. There's also one from BIOMIN. And this will guide you through the whole topic of sampling correctly. Please also get in touch with our sales representatives. They will for sure find the perfect solution for your requirements. Another thing I want to point out in regards of sampling is the mycotoxin sampling tool provided by the FAO. I think it's a great way to find your best fitting sampling plan for your requirements. You can put in the grain or commodity you are testing for. You can choose the confidence intervals that you want and the level of risk you want to take, and then get a sampling plan out of it.
All right, well, thank you, Philip, for those tips. We're going to switch gears and turn to the audience once again for another poll question. Our third and final poll question is the following. In the past 12 months, which mycotoxin mitigation methods have you used? And here you can choose several if you used more than one of these over the past year. The first is a mycotoxin binder added to feed. 2, a multi-strategy mycotoxin deactivating feed additive. 3, good quality control and feed management. 4, mycotoxins are not an issue for us. 5, I'm currently looking for a solution. Now, please go ahead and select the one or multiple answers that reflect your situation. We already have more than half of you. We have the results in from the majority of our audience. We're going to leave the poll open for a few moments as those results continue to come in. All right, it looks like we have several in the running. All right, we have a large majority of you have already answered, so at this point I will close the voting. Thank you for your input. I will now announce the results of the third poll question. So for the first one, a mycotoxin binder added to feed was selected by 48% of you. That's the highest result here. 30% for a multi-strategy mycotoxin deactivating feed additive. 42% for good quality control feed management. 8% for mycotoxins are not an issue. And 17% currently looking for a solution. So it looks as though, as I've said, the binder is the top strategy out of this poll results from our audience, Simone. Is binding sufficient to tackle the mycotoxin challenge?
Yeah, first, that's a quite interesting outcome, and binding is efficient if you have the right mycotoxins, but to understand an efficient deactivation of mycotoxin, we have to start from a different point. We know through the various structures of mycotoxins, which you also see displayed on the screen now, that they have different effects on animals, and that they, because of their structures, they require different strategies to have an efficient deactivation in the animal. And within those strategies, there is three major components described. On the first hand, we have the adsorption, which is the same as the binding, which is done by the bentonites. Then we have the biotransformation and the so-called bioprotection. So, to have an efficient and specific adsorption or binding for the elimination of adsorbable mycotoxins, here namely the aflatoxin as the most prominent one, this is when we talk about binding. So here we have to differentiate to the next strategy included, the so-called biotransformation. The biotransformation strategy offers scientifically advanced solutions available to counteract non-adsorbable mycotoxins. Here we're mainly talking about the group of trichoticins, with deoxynivalenol being the most known one, and the fumonisins, but as well as cerelenol. Biotransformation means that mycotoxins are converted into non-toxic metabolites, which are environmentally safe, and this process is happening within the digestive tract of the animal. And last but not least, to sum up an efficient strategy, we have the bioprotection. The bioprotection provides, via different phytogenic and phytophytic substances, immune and liver support, and helps to counteract in the animal the harmful effects of mycotoxins.
All right. Thank you, Simone, for that overview of the different strategies to tackle mycotoxins. You know, plenty of today's participants have asked this following question. With these different options available, how do I choose the right product and the right strategy?
Yeah. You know, I only can give you a suggestion or share with you my experience, because once you have identified your problem by conducting feed analysis, you should choose for sure a product which is efficient and safe for your animal. An option for this choosing of a product could be that you look on the official status. For example, Mycofix is the only worldwide feed additive which has 3 official EU authorizations for mycotoxin deactivation. And the important thing is, this authorization tells us that we fulfill the strict requirements on identity of the product, on safety and efficacy, which was proven by standardized processes within the animal. The efficacy of this product has been scientifically proven not only in vitro studies, but also in vivo studies by using a recognized relevant biomarkers. A biomarker helps us to evaluate the efficient mycotoxin deactivation to the non-toxic metabolites in the animal's organism. To sum up, these 3 components which you see displayed on the slide include a selected bentonite for the adsorption or the binding of the mycotoxin, a patented biological component, the so-called BIOMIN BBSH, and a pure specific enzyme, the FUMzyme, which both show a very efficient biotransformation in the animal.
Right. So we've seen the approaches to sampling and tips for sampling. Let's say we get the sampling right, and the mycotoxin screen report comes back with no or low contamination. You know, for a livestock producer or feed mill, does that mean there is no cause for concern?
No, because we definitely know there is no safe levels for mycotoxins, and we always also have the co-occurrence. But let me give you an example to better understand my point. Here we display an example of a dairy farm which had about 100 Holstein cows, and the main problem observed on the farm were loss in milk production, an increase in cell counts, which namely might be considered as a typical problem caused by deoxynivalenol, but also a general loss in performance was observed, which is often discussed to be the reason for multiple mycotoxin contamination. Below you see the analysis of the major mycotoxins, and when you have a closer look, you see that the contamination was quite low. But however, the farmer still was not sure if his compound feed was of good quality. Therefore, our BIOMIN sales staff offered them a possibility to go a step further than the routine analysis and to use the so-called spectrum 380, which gives a complete picture of the total mycotoxins load in a sample by measuring over 380 mycotoxins, their metabolites, emerging mycotoxins, masked mycotoxins, and masked mycotoxins by a so-called LCMS-MS method, what we have heard earlier from Philipp this day as well. But this service was developed in cooperation of BIOMIN with the leading institute for mycotoxin analysis from the University of Applied Natural Sciences in Vienna with the Institute of Eva Thurm in Austria. After we have analyzed the feed with spectrum 380, we could take a closer look into the farm's problems. For example, the total sum of seralenone, including the masked forms, which is called here the seralenone sulfate, was no longer about 80 ppb, but instead was 200 ppb. So the result already doubled. But let's go a step further. If we then look on the trichoticine side, we knew that if we only would go for DON to be analyzed, we would have a result of 300 ppb, deoxynivalenol, which would not be a real major concern for ruminants. However, if we sum up all the other B trichoticins found in this sample, we get a complete different picture. On the one hand, we again have a masked form, the so-called DON3-glucoside, which was reflected by 55 ppb, but more important in this case was the amount of nivalenol, which was over 1 ppm. This is more than 3 times higher than the deoxynivalenol we found in the first step. And research studies have shown that nivalenol can have an even higher toxicity compared to deoxynivalenol in the animal. And as a third major group for mycotoxins, we have the groups of fumonisins. And when we take here a closer look, normally we majorly talk about the fumonisin B1, which was around 460 ppb, but we sum up all the different occurring fumonisins, we have a total of over 800 ppb, which is almost double the amount of fumonisin B1 alone. So I think this is a nice example to show that although we experience low levels, there's always more to find out or to research or to get to know. And with this, I think it can point out again how important it is to do a proper mycotoxin risk management, which includes the correct sampling on the one hand, as we have heard from Philipp, the right mycotoxin analysis, and at the end, an efficient mycotoxin deactivation strategy.
All right. Thank you, Simone, for that their eye-opening case. At this time, I'm going to recap for those of you in the audience. We've already had some questions about some of the tools that have been mentioned by both of our speakers. The first one being the MycoFix app, as Simone mentioned, along with the MycoFix video that is available on www.biomin.net. Philipp brought up the sample guide available on romerlabs.com, along with the FAO mycotoxin sampling tool, which is available on their website. At this point, We're now going to open up to an audience question and answer session. We've already had questions coming in throughout today's session. We're not going to have time to get to all of them, but we will address as many as we can. Let's start with one for Philipp. So here's a question from the audience regarding pressure to reduce or eliminate the use of solvents in industry in terms of detection tools. I guess that relates to green testing, which has become an important topic in recent years. What is green testing and what are the benefits?
If we come to rapid testing, to on-site testing, what you have to do is that you have to extract your mycotoxin from your commodity. And as most mycotoxins are not water soluble, you would need some kind of solvent for that. And what is traditionally, or what was traditionally applied were organic solvents like methanol, like ethanol, acetonitrile. And the problem with these solvents is that most of them, like methanol, are considered hazardous. So they bear health risks, and they also bear the problem that you have to dispose them properly, which also is a cost factor which you shouldn't underestimate. It's for sure there. Therefore, the industry is going in the direction of water extraction, which works the following. You take water as a basis to extract the solvent, but you also have an extraction buffer. And this extraction buffer is harmless to the environment and also to the human body, and therefore a safer way, and especially for rapid tests where with strip tests you may have untrained personnel or personnel that is not used to deal with organic solvents. I think it's a great solution for them, and I think it's for sure a solution for the future. Romer Labs is having the AquaStrip aflatoxin vortex kit available on the market, and we have nice results in that.
Okay, that's great. Certainly an interesting development and part of sustainable business practices. Thank you for sharing that. Our next question from the audience goes to Simone. Can a mycotoxin deactivating product diminish the vitamin or nutrient content of feed?
Yeah, well, that's a very important question to be addressed, but let me put it a little bit a different way. It's important when you choose a binder that you know that it was evaluated in a good way, because we know there's a lot of binders out there with very different compositions, and we know there is this product which show a high range of binding because being unspecifically, they bind everything. So if you use a high dosage, you may bind the mycotoxin, but you also may bind the vitamin and the nutrients available. And this is maybe not the case you want to do to your animal. So I can only tell you that within the evaluation process for the authorization, we had to go in 2 steps. On the first way, we always have the in vitro binding tests. So we show that our product is not binding the vitamins, the nutrients, the antibiotics or whatever in vitro. And the next is to evaluate this in vivo to really be sure that we do not do any harm to the animal. But I know it's very hard in the field to choose this, but one thing always could be, as I mentioned before, to look if you have an official registration, authorization, and to show if the companies can give you this information to have safe product for your animals.
Okay. Now, you had mentioned their evaluation of the product efficacy in vivo. One of the questions we have here is, how do you evaluate the ability of Mycofix to biotransform mycotoxins in vivo? So could you tell us a bit more about that?
Yeah, the topic of biotransformation is a very important one, because it's quite a new technology, just known for a few years. A lot of research is still going on, and we investigated a lot of research, and it was a great challenge to find the right biomarkers. Biomarkers in this case is to show that the mycotoxin, which is biotransformed in vivo, to show that those metabolites, those non-toxic metabolites, can be found. So you have to know how it's biotransformed in the animal, what is the way in the animal, because we know not all of the mycotoxins have the same bioavailability, so you have to find the right tissues to take. And what is also important when we talk about testing biotransformation, when you know the biomarkers you want to test for. To give you the most prominent examples, maybe for DOM degradation, we have the so-called deoxynivalenol 1, the short form DOM1, which we test for. But here it's important to say that you need controlled scientific setups to really be able to measure the way of degradation. Another example might be the so-called sphingonin to sphingosine sphingolipid ratio when we talk about the degradation of humonicins, which can be measured in different matrices in the animals. So this is a very complex process, and a lot of investigations are necessary and good setups to show, and this is what we do in our trials, that you have an effective product.
Right. Thank you for that. We have two related questions for Philipp. I hope you don't mind. Let's see if we can group these together or answer them separately as you see fit. We have a question about rapid tests. So which mycotoxins can you test for with rapid tests? And the second question there is, are there quick tests for finished feed to indicate the presence of DON or ZEN?
I want to point out our ELISA portfolio first. It's a big portfolio covering most regulated mycotoxins. I hope I don't miss one. I have them here: AFLA-M1, AFLA-B1, total AFLA as well, including AFLA-B1, total FUM, OTA, T2, a combination of T2 and HT2, so on and on. Okay, that's. I hope I didn't miss one. With strip tests, we offer DON, FUM, and total AFLA, so total FUM and total AFLA. And for concerning the question of feed validations, we have validated different formulas of feed already successfully. So we have experience with that, and yeah, it's working for us. And I encourage everybody to approach this.
Great. If we can stay with you, Philipp, we have a question here about the difference in analysis results between ELISA tests and reference method HPLC.
Okay, yeah, that's a question that comes often, actually, because I think people want to know HPLC reference method, good result, ELISA rapid method, not so good result. Why is that? First of all, it's not like that. You can't say good or bad. If we want to explain this, we have to look at the technologies. And HPLC and ELISAs are really different technologies. ELISA work with proteins, antibodies that catch the analyte. In our case, that would be the mycotoxin. And this reaction gives a signal that can be measured. With HPLC, the same basis is on the LC-MSMS method. You have the basis of chromatography. So that's what the C stands for in HPLC and also in the LC-MSMS. And to explain it, I want to simplify drastically, actually. But what is happening in chromatography is that you basically send a sample through a column. This column, within this column, your analytes that are in the sample will be separated from each other, and then these analytes can be detected by some kind of detector, might be UV-Vis, light detector, analyte by analyte. So because of these different approaches, of this different technology, the first thing is that you will never get the exact same result with both methods. And that's, I think, it's really important to understand. But what we see with reference methods based on chromatography is that the results are more reproducible.
All right, certainly something to consider then. Simone, we have a question here about the material you presented earlier on how you determine the risk and the threshold for each livestock species in those global results that you presented to us.
Yeah, I want to thank for this question because this is one we get on a regular basis. And this is a very complex one because this thresholds we developed, this combines a year-long experience in the field and in different trials we investigated within research corporations, within field. So this is mostly a summary of experience in the field. Then we always have a look based on the guidance values we have from EFSA and FDA for different mycotoxins, but as well also on research from other institutions. So we always try to stay updated, get updated, because when methods are getting more sensitive, we learn more about biomarkers, we see that there is more effect, which we do not see in a clear stage, but we see on the underground, as we have the reactions on the immune system. But nevertheless, not every animal will react the same way with the thresholds we recommend or we give you as a guidance, because we know there is huge individual variations, and it also depends on the status of the farm, on the management of the farm. So this is a very complex topic, and we give you suggestions because of our year-long experience.
All right, no, thank you. We're going to try to take one or two more questions as we're getting close to the end of our session. We have actually a pair of questions here regarding dairy carryover of mycotoxins. Let's start with you, Simone. Which mycotoxins are important to look out for in regards to carryover in milk?
Yeah, this is a very important question to be addressed, and here I want to point out overall the bindable aflatoxin again, because aflatoxin is the only really regulated mycotoxin within feedstuff. We have different regulations within the European Union and the US. For example, in Europe we have the complete feed for dairy has a limit for 5 ppb. Compared to that, in the US we have a regulation limit of 20 ppb. So this is the only aflatoxin where we really have to follow the rules. Otherwise, you have to throw away your feed. But why is this important? Because aflatoxin B1, which can be measured in feed, is biotransformed in the animal and excreted with the still toxic form aflatoxin M1 via milk. And there, it's important because we know it's a great health threat for humans, because it's one of the greatest cancerogenic. And so we also have to consider the carryover rates, because you see there's a high variation between the regulations of Europe and America. But I want to give you on your way that from research it's already known that the carryover rate of afla B1 to afla M1 in milk is between 1 to 6%. And that's why it's important to screen as well, again, your feed, because to keep the quality, but on the other hand, also to know what's in your milk for human health reasons.
Okay, so yeah, it sounds like that's definitely worth keeping a close eye on. So that brings us back to monitoring. Philipp, what expertise can Romer Labs bring to bear in regards to aflatoxins in the feed or in the milk?
Romer Labs offers testing solutions for both aflatoxin B1 and aflatoxin M1. For B1 we have an ELISA test, and for aflatoxin M1 we have both ELISA tests and strip tests. The remarkable thing with our M1 ELISA tests is that they can measure down to a very, very incredibly low concentration. So we are measuring PPTs with our aflatoxin M1 kits. And well, that's also showing one strength of rapid tests, that you actually can have a very, very low LOD if you don't have to apply dilution steps before. And that's not necessary with the aflatoxin M1 test.
All right, thank you for that, Philip. And Simone, I'd like to thank you as well. Thank you both for joining us here today. We have just one word for the audience before we close out today's session. You will receive an email including links to today's recording, the BIOMIN mycotoxin survey report, and the Romer Labs sampling guide in the next 24 hours. As we close, or when we close, you'll be prompted to answer a short survey on today's webinar, and it will take you about 2 minutes to complete. We ask you to please do so. Please take the time to give us your feedback, and that will allow us to improve our webinar program and identify future topics of interest for you. With that, I want to thank you for joining today's webinar on mycotoxin testing and survey results, and we'll see you again next time.